Okay. Well, I guess it's 2 o'clock, so we can go ahead and get started. Thank you guys so much for being so flexible and willing to jump on here. Because we had several requests, we wanted to make sure that Dr. Whitworth could answer all of your questions, but not schedule 8 different interviews. So we really appreciate you guys kind of going with this with us. So from what I understand, and you guys know this better than I do, but I think you can pin Dr. Whitworth's video if you go to that top right corner where those 3 little dots are, and you can pin her and make her the main screen. You should also be able to record this on your own. And if you can't, we are recording it on our side, so if something happens, feel free to reach out. I'm happy to send it to you afterward. And with that, I think we can go ahead and get started. Dr. Whitworth, do you want me to just start calling on people, or is there anything you want to say first?
Whatever you guys want to do. I'll talk about whatever you want to talk about.
Okay. Well, Lily, I think you were the first one to reach out this morning and the first one on the call, so I'll go ahead and give you the floor.
Thank you. Well, thank you, Dr. Whitworth, for making time to speak with us. The reason why I reached out was because we saw that Cook Children's policy in place starting on Monday when it comes to patient visitations. Can you talk to us about kind of the reasoning behind this new rule going into place?
Sure. We have been keeping a close eye on community numbers for COVID, and we know that they have really gone up dramatically over the last 5 or 6 days. And so in thinking through that, we want our patients in the hospital and our staff to have less exposures to the community. And so this conceivably has 200 less people in the building during the day, which is just going to reduce exposures. And that's really the main goal.
And how many patients at Cook Children's are currently being treated for COVID? And has that number itself seen an increase in the past few days?
You know, we are very fortunate in a pediatric hospital because the children just do not seem to be as ill as the adults in large numbers. So we've had some very ill children throughout the course of the pandemic in the ICU, on ventilators. We've had some really sick kids. Today, we have 11 children in the hospital with COVID. We've got 3 in the ICU and 8 on the floor. And I do think that's the most that we've had since the pandemic started, as far as I can remember. We may have had a day of 12, but not really more than that. So there are more at the moment than there have been.
Certainly for parents, caregivers, they want to be with their children during these times. My understanding is the new policy is that it would just be one primary caregiver, no siblings and no other visitors. Can you tell us about just kind of, was it difficult to reach this decision? I'm sure you guys had to, take a lot of consideration.
It's terrible to reach this decision because we're all parents, and so we are doing our best in a really difficult time to try to keep everybody safe. The adult hospitals forever had no visitors, and I don't know how they did that. I don't know how that would have just been a nightmare. So these kids will at least have a parent or a relative at the bedside if they want to 24 hours a day. They won't be alone. And we just feel like this is the safest thing for everyone.
Thank you.
Kelsey?
Kind of piggybacking on what Lily just said, how will this affect, I know that we're not supposed to get together for the holidays, but just coming into this season, what does that mean for the holidays for these kids?
For the children who are in the hospital for the holidays, it means that they will have one caregiver with them at a time. And fortunately, we live in a day with a lot of technology, and hopefully that caregiver can work out something like a Zoom meeting or a FaceTime. And if the children feel like it, if they're well enough to do something like that, but there won't be any large volume of people visiting the children. They won't be able to have a group of family in the room. And, it's gut-wrenching, but I think it's important.
And at what point or what has to happen for y'all to decide to lift this restriction?
We are going to lift the restriction when we feel like it's safe for our patients and families to do so, and also safe for our staff to do so. And so it would have to be at a time when community transmission was much lower than it is now. And I don't have a cutoff number about that at this point, but we look forward to going back to 2 visitors when we feel like it's safe.
I'm good, Kim.
Thank you. Bailey, I see you're on here if you want to ask your questions.
Hi, yes, Kim, thank you. And I came in a little bit late, so y'all might have already answered this, but how is your capacity looking? Do y'all still have beds available, or are you cutting it close?
We have plenty of beds available. We are in great shape. What we had just said was that children typically have not required a large volume of hospitalization like adults. Most children do fine. They get over it and they don't need to be in the hospital. At the moment, we have 11 in the hospital. We have 8 on the regular floor and 3 in the ICU. And we have plenty of room for whatever we need to take care of.
Okay, thank you so much. I'm good, Kim.
Okay, thank you. Miranda, are you on here?
Hey, I'm on here. I'm all set for questions, I think.
Okay, perfect. KDFW? Or is somebody else going to jump in?
Dr. Whitworth,
Okay.
quick question, sorry, if you wouldn't mind. One thing I forgot to ask, are there any exceptions to this policy as of this point?
We have exceptions for the emergency room and for end-of-life situations. So there are exceptions for that.
Thank you. The one other thing I had, earlier during the pandemic, there was a lot of talk and there was some restrictions on elective surgeries. At Cook Children's, I know it might be a little more difficult because these are, children. Are there any current restrictions on what may be considered elective or quote unquote non-essential surgeries?
No, at this point, all surgeries are being done. There's not been any cutting back on that.
Thank you.
Mm-hmm.
Hey, this is Miranda. I actually did think of a question. I just wanted to confirm with you because, so much has been happening the last few months, but there was a point where Cook Children's had actually lifted restrictions, right?
Yes. We had gone from 1 visitor for inpatients to 2 visitors for inpatients around October the 1st when things seemed to be better. And then we moved, then our change now is because the numbers in the community are getting worse. So we were at 2 visitors for inpatients from October 1st until this coming up Monday, November 16th.
And do you know the current numbers right now for kids in your hospital who are being treated for multi-system inflammatory syndrome?
Yes, we have had, since the start of the pandemic, we've reported 21 cases to the health department. At this moment, I think we have 1 or 2, but I'm not positive about that. It's not more than that. It's not more than that right now. But that 21 since the beginning of the pandemic.
Thank you.
Mm-hmm.
And
Are
can
there
I
any
just,
other questions?
oh, I'm sorry. Can I just confirm quickly too? And Kim knows I talked to Dr. Rister yesterday, but I just want to confirm today that there have been no deaths at Cook Children's, whether it's from COVID or from multi-system inflammatory syndrome.
That is correct. We have not had any deaths. I know that there are deaths in children around the country, and as the volume of these cases increases, then there will be more. But fortunately for both of these diseases in pediatrics, the mortality rate is extremely low, and we're very grateful. It's a little bit higher for teenagers than for younger kids.
Dr. Whitworth, did you want to comment at all on just how's the staff doing? I mean, what's the morale like there? I know it's been a long 8 months with, a lot of questions, and just how are you guys doing?
I think everybody is doing really well, and I think that we go to work with a goal and a mission, and from that standpoint, things are good. I think all of us want our lives back, me included. You know, I think there still is that, when is this going to be over, and how much longer sort of a sense. There's just definitely a little bit of that sense through all of us. But I think we're really lucky. You know, we work with children who make you laugh, and we all, I think, enjoy our jobs at this point. So I think generally just walking around the hospital and making rounds and having clinic, I think we're doing pretty well. But thank you for asking.
Thank you.
Does anyone have any more questions for Dr. Whitworth? If not, we will go ahead and wrap this up. Thank you guys so much for joining, and thank you, Dr. Whitworth, for making time for all of us today. We so appreciate you.
You all have a good day. Thanks for checking on us.
Thank you.
Thank you.